Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Rsna 20 to 24% of breast cancers diagnosed in women aged 18 to 49. Break. About 20 to 24% of all breast cancers diagnosed between 2014 and 2024 were in women aged 18 to 49 years, according to research presented at the annual meeting of the Radiological Society of North America, held from November 30 to December 4 in Chicago. Stamashadistownies, MD, from Elizabeth Vendor Breast Care in Rochester, New York, and colleagues examined trends in breast cancer incidence in a retrospective review of breast cancer cases diagnosed in women aged 18 to 49 years between 2014 and 2024 at a community outpatient breast imaging facility. The researchers identified 1,799 breast cancers diagnosed in 1,290 women aged 18 to 49 years. Overall, 41 and 59% of cancers were detected on screening and diagnostic evaluation, respectively. Most cases, 80.7%, were invasive cancers, while 19.3% were non-invasive. 1.8% of patients presented with metastatic disease. 21% of cases had a documented family history of breast cancer. Tumor grade distribution included low-grade, intermediate-grade, and high-grade tumors, 19.3, 43.9, and 33.0%, respectively. 8.6% were triple-negative. In an age-stratified analysis, 24 and 76% of cancers occurred in women younger than 40 years and aged 40 to 49 years, respectively. The absolute number of cancers in this cohort remained stable at about 20 to 24% of total breast cancer volume per year. We can't rely only on age alone to decide who should be screened, Distownies said in a statement. Paying closer attention to personal and family history, and possibly screening earlier for some women, could help detect these cancers sooner. Press release. More information. Disclaimer, statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. And copy, 2025 Health Day. All rights reserved. Ad as a preferred source on Google. Read this next smartphone ownership link to depression in early /speak. Speak essence. In early adolescence, smartphone ownership is associated with depression, obesity, and insufficient sleep, according to a study published online December 1 in Online screening questionnaire can identify patients with axial spondyloarthritis. A tool-based strategy for self-referral of patients with chronic back pain, CBP, is feasible for early diagnosis of axial spondyloarthritis, AXSPA. Current used screening guidelines miss many patients with lung cancer. Current U.S. Preventive Services Task Force, USTF, lung cancer screening guidelines miss about two-thirds of patients with lung cancer, according to a More news resources to MedWatch. Drug alerts daily. Med news for health professionals. New drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.